According to the U.S. Census, 51.9% of Valdosta's residents identify as Black Americans, meaning over half of the city's population is at increased risk of developing uncontrolled hypertension. With 34.8% of Georgia residents already diagnosed with hypertension, it is important to educate the population on the disease, the added risk factors to health, and ways to prevent and control high blood pressure. This educational presentation is intended to help with identifying the risk factors for the disease and ways to reduce the risk with the use of healthy diet. The teaching plan will also include community resources available to those who wish to seek additional help in controlling and modifying risk factors. Education on hypertension is needed to ensure that vulnerable populations, such as those of African descent, are taking every measure to reduce the risk of developing hypertension, as well as helping to decrease the severity of the disease. In 2010, approximately 137,000 hospitalizations occurred among Georgia residents due to cardiovascular disease, with 3,775 deaths caused by stroke and 940 deaths caused by hypertension. According to the Department of Public Health, more than 2.3 million Georgia adults do not know the modifiable risk factors for cardiovascular disease, thus furthering the need for education. Hypertension Risks, Diet, and Resources by Amber Kreiser in collaboration with Chelsea Weeks. There are two types of risk factors that we will discuss today, modifiable and non-modifiable. Modifiable risk factors are those that you can change, and non-modifiable risk factors are those that cannot be changed. These non-modifiable risk factors include genetics. Those who have a family history of hypertension are more likely to develop it. Race and age are also non-modifiable risk factors, and those of African descent have the highest likelihood of developing hypertension, especially those aged 55 or older. Some modifiable risk factors are as follows. Salt intake is one of them. The American Heart Association recommends a daily dietary intake of anywhere from 1,500 to 2,300 milligrams of salt. Weight is another modifiable risk factor, and that plays a big factor in blood pressure. Those who are considered to be obese are at a higher chance of developing hypertension than those within a normal BMI. We recommend for those that are overweight to participate in exercise, which is another modifiable risk factor, for at least 3 to 5 times a week. Those of you who are not already exercising, we do recommend that we start. You can start at 1 to 2 times a week at first and work your way up to 3 to 5 times a week. These exercises can include anything from aerobics to weightlifting. We do recommend that you at least have one form of cardio in there, so maybe get on the treadmill and running for 20 minutes each time you exercise. Alcohol and smoking are a huge contributor to the risk factors of developing hypertension. We do recommend that we get on some kind of smoking cessation, such as Chantix or some other cessation that you and your doctor discuss, as well as stopping the use of alcohol. If you are a heavy alcohol user, we do recommend following up with somebody such as Legacy or Greenleaf here in town to go ahead and help with the cessation of alcohol. Stress is another modifiable risk factor when it comes to hypertension. Stress is something that we experience every day, but those under an increased amount of stress daily may be more likely to develop hypertension, especially in the presence of any of these other risk factors. The final modifiable risk factor, which we'll be going a little bit more in depth with today, is diet. It is one of the biggest modifiable risk factors, and that is the reason why we're going to talk about it a little bit more. We recommend that you have a heart-healthy diet. One of these diet plans is the DASH diet, or also known as Dietary Approach to Stop Hypertension. This approach is a lifelong diet to healthy eating, and if followed correctly, this plan can help decrease your systolic, which is that top number, by 8 to 14 points over time. The main purpose of this diet is to incorporate foods that are high in potassium, magnesium, and calcium, and those that are low in sodium. Like we mentioned earlier, we do recommend anywhere from 1,500 to 2,300 milligrams of sodium max a day. And this diet is based off of a 2,000 calorie count per day. Here are some good tips to remember when we go grocery shopping. With the DASH diet, we recommend 6 to 8 servings of grains a day. Whole grains are going to be your best choice, and those can be found in cereals, rice, whole wheat bread, or pasta. 4 to 5 servings of fruit a day is what the DASH diet recommends, and you can choose fruits such as bananas, which are high in potassium, apples, peaches, and pears. 4 to 5 servings of vegetables a day is what we strive for. Those can include anything like tomatoes, carrots, broccoli, or sweet potatoes. You want to stay away from canned vegetables as much as you can because those are a little bit higher in sodium, and you'll get to that 1,500 or 2,300 milligram max of sodium quicker using those. Best vegetables to use are fresh vegetables that you decide to steam, or you can go ahead and get the frozen vegetables out of the frozen section. Just make sure we are watching that sodium count on there. I would recommend to get at least 2 to 3 servings of dairy a day. You can get that from either drinking milk, yogurt, eating cheese, or other dairy products that you prefer. We also recommend that we get anywhere from 4 to 5 servings a week of nuts, seeds, or lumens. We do recommend almonds, kidney beans, peas, lentils, and any other kind of nuts or seeds you like. Sunflower seeds are a good choice. We just want to make sure that we're not getting the salted sunflower seeds. To go ahead and get the unsalted one. Those are a nice snack. We recommend that you eat 6 1-ounce servings a day, a maximum of 6 1-ounce servings a day of lean meats, and your lean meats are going to be your chicken, fish, pork, and things like that. You do want to try to stay away from beef just because those are a little bit higher in fat, and we do want to kind of keep an eye on how much fat we are taking in, which we want anywhere from 2 to 3 servings a day. We can add healthy fats in, such as margarine, mayonnaise, and salad dressings. Avocados are a good choice for healthy fats as well, and then you'll also be kind of hitting those vegetable servings as well. Just want to watch out for any of the bad trans fats. Sweets, we want to limit that to 5 servings or less a week of simple sweets, and this can include anything from like jelly, jams, things like that we put on our toast and bread in the morning. Some community resources include Partnership for Health, which is an income-based primary care facility. You can go ahead, they'll take a look at your income, see how much your income is, and then you pay based off of that. There is what is called a Check, Change, and Control program that is sponsored by the American Heart Association. The nearest one to Valdosta is in Atlanta, Georgia, and Atlanta is about 3 hours from here. But what that is they, they will monitor your blood pressure, give you some things to change in your diet and lifestyle to help control that blood pressure. It's a little bit far of a drive, but if you have family in Atlanta and you'd like to give this resource to them, that is a good resource. For those who are migrant farm workers, there is a clinic in Lake City that you can go to that is specifically designated for those migrant workers who don't have insurances and can't really pay too much for health care, and that is an option for you guys. Greenleaf and Legacy Behavioral Health are 2 of the mental health facilities here that also help with addiction, such as addiction to opiates or other drugs, as well as alcohol. Since alcohol is a huge risk factor for hypertension, this resource is in here to help with alcohol abuse. So this is a good resource for you guys. Today we do have some resources for you to go home with to help when it comes to deciding what foods that we want to eat. We do have the DASH diet listed here, as well as the number of servings for each food group a day. And on the back side, there is a grocery shopping list that gives a list of some good choices of foods that you can pick to stick with that DASH diet. Obviously, there are more choices of foods out there, and you can look on the American Heart Association for the DASH diet, and they do have a grocery shopping list there for you. And that is a good resource to take with you when you do go grocery shopping. This community health teaching to Black Americans living in Valdosta is intended to help identify the risks of uncontrolled hypertension, as well as ways to reduce development of the disease. With the help of the informational take-home material, the teaching plan will help with proper diet as well as food selections for those within the vulnerable population. Ideally, this education will help this population be more attentive to their blood pressure and seek primary care help early on, which will help decrease the number of deaths from hypertension and hypertension-related strokes.